Systemic lupus erythematosus, autoimmune disease. What is systemic lupus erythematosus? It is more commonly known as lupus. It is an autoimmune disease, and the body mistakes the healthy tissues for being unhealthy tissue, and therefore it goes and destroys it. There are different types of lupus. There are two most common types. One is medically induced, which only occurs after you take certain medications, such as seizure medications or antibiotics. And then if it is medically induced, it normally goes away once that medication is stopped. Then there is genetically inherited, which is passed on genetically through DNA, so you're born with this. If it is genetically inherited, normally it's remissive at first, but then it will be brought out once exposed to certain factors and triggers, such as sunlight. Sunlight often causes skin lesions to the surface of the skin. Lupus is diagnosed in several different ways. There are multiple blood tests that can be performed. They detect these specific autoantibodies, since it's an autoimmune disease, that help make the diagnosis of this. One of them is the anti-nuclear antibodies test. Then there is the anti-double-stranded DNA antibody. Long word, I know, but it's a very specific type of ANA antibody. It's found in about 30% of people with lupus. There's also a serum complement test, which measures inflammation. Lupus is more common in some people than it is in others. It is more common in women than in men. It is more commonly diagnosed between 15 and 40 years of age, but we don't need to stick between that age bracket. And then it is most common in Asians, African Americans, and Hispanics, but those of Caucasian ethnicities are not excluded by any means. What is affected by lupus? Well, lupus affects just about all parts of the body. Inflammation is the main symptom of lupus, and it affects most parts of the body. Those areas include the kidneys, which is the most commonly affected area of all the organs. The brain, with seizures, memory loss, headaches, and strokes are very common. Vascular system, including the veins and arteries. Vasculitis, which is inflammation of the veins and arteries. There's clotting is often very common, and anemia seems to be the most common out of all the vascular system problems. Cardiac, there's pericarditis, which can cause heart attacks. Pericarditis is an inflammation of the pericardium, and since we discussed that inflammation is what affects most parts of the body, and inflammation of that pericardium, that muscle tissue, that can cause heart attacks. Respiratory, when your lungs get inflamed, it can cause respiratory failure. They need to be able to expand and contract a certain amount, and when they're not able to, due to that inflammation, breathing problems happen in multiple different ways. And then the lymphatic system seems to be the most affected of all the areas. The nervous system, I know we already talked a little bit about the brain, but the nervous system in itself also houses the spinal cord. So the memory loss, things like that can happen, and fibromyalgia is common. The integumentary system. Now this is the biggest thing. It's almost always affected. The skin usually gets lesions in some way or another. Now there's facial reddening, which is very, very common. And about 4 out of the 11 criteria in order to diagnose lupus include the involvement with the integumentary system. And then pregnancy and lupus. Many women have difficulty getting pregnant with lupus. Miscarriages and ectopic pregnancies are very common. Preterm labor and preeclampsia are super common as well. And doctors recommend that women wait about 6 months after being on medication before they try to become pregnant. Now, Raynaud's phenomenon. This is very interesting if you've ever seen it. There's a common phenomenon of the fingers and the toes. They turn blue or like a whitish color when exposed to cold during stressful times. If you squeeze your fingers really tightly for a little bit, it draws away that circulation, then you let go and they have that white color. It's like that, but it involves no squeezing or anything like that. It just happens with stressful times and cold. I'll show a picture of that towards the end. Now, some common symptoms: headaches, shortness of breath, like we were discussing before with the different nervous system, brain, heart, respiratory, all those different systems working together. They cause those symptoms, to come out. Chest pain, dry eyes, memory loss, confusion. And it is not expected that we see all these symptoms, but definitely a combination of them is expected. Now, the cause. There is really no cause determined yet, but they're working still. There are research foundations for this. Now, without a known cause, though, there is no cure. But there are flare-ups that happen, like from certain triggers, and those flare-ups can be prevented and helped out a little bit when those triggers, such as a lack of sleep or sunlight exposure, you can try and sleep more, you can limit your sunlight exposure, and hopefully you won't get those flare-ups. Avoiding those triggers, like I was just saying, prevents those. So there are some medications for lupus. NSAIDs, which are non-steroidal anti-inflammatory drugs, such as Tylenol and ibuprofen, common over-the-counter drugs. They're known to alleviate inflammation, and they also help with pain every once in a while. When you get a lot of inflammation, you can tend to get pain in those areas. Anti-malarial drug like chloroquine is one of the common drugs used for lupus. Corticosteroids such as prednisone. A lot of times people use those for use those inhalers, such as a prednisone inhaler, and that can also be used for lupus. And then there's immunosuppressives and methotrexate that are also commonly used for lupus. Now the prognosis. Prognosis is just how long do you expect a person to live? What is the life expectancy with someone with this disease? The prognosis for lupus, most people lead a normal lifespan. However, there are some people that have other diseases, such as heart attacks and other cardiovascular problems, for example, that can shorten that lifespan. Some others may be low platelet counts. There's a lot of vascular system problems with people with lupus, and if somebody has a low platelet count, they can have a shorter lifespan from that. The disease also has an effect on the kidneys, as we said before, in the brain, and that may very well shorten the lifespan from the different traumatic, numerous amounts of kidney stones and other kidney failure. That can definitely shorten a person's lifespan, but the cause of death would most likely be related to kidneys or brain if it was that situation versus death by lupus. Now here are some of those pictures. As you can see up at the top, there's that white like I was saying before, but it kind of travels itself down in its own way. And then the blue too, it looks just like somebody's got frostbite. It's very, cold looking. And then there's a picture here of common lupus symptoms based off of each different part of the body, showing with like the brain, the headaches and memory loss, the eyes, dry or puffy eyes, and increased light sensitivity. The mouth, they get sores inside the mouth or nose, mainly because of the skin lesions we talked. A butterfly rash is very, very common on the skin near the cheeks. It goes over the cheeks and the bridge of the nose, and it looks like a butterfly. And it can worsen with sun exposure. The butterfly is actually the most common symbol for lupus. The lungs and the heart, as we said earlier, and then there's shortness of breath and pain in the chest. The stomach, you can get nausea, vomiting, recurrent and persistent abdominal pains, bladder infections, and blood in the urine. That relates mainly to the kidneys. Fingers, toes, or the tip of the nose may turn white or blue, like we just discussed with Raynaud's phenomenon. There's fatigue and unexplained fevers occasionally happen too. And then there's a lot of times persistent pain and swelling of the legs, joints, and their feet. A lot of people are diagnosed due to a rheumatoid arthritis to start with. And then here's a picture of those skin lesions. It's kind of like a mapping, and they just have like that ring around them. It's a very interesting looking rash, and it's quite singular. These lesions, they're quite singular to lupus. And then here is a lovely list of my references. Alright.